Good afternoon, and welcome to our virtual program, Your Child's Athlete Health Toolkit, What You Need to Know. We're very grateful to have Dr. Mitchell Albert, Dr. Nicole Marcantuno, and Dr. Ulrich View speaking with us today. A little bit about our speakers. Dr. Mitchell Albert is from New Jersey, having grown up in Piscataway. After graduating Phi Beta Kappa from Emory University, he returned to New Jersey, where he went to medical school at the Rutgers University New Jersey Medical School and did his residency in the same program. He subsequently did his pediatric cardiology fellowship at New York University. Dr. Alpert is board certified in both pediatrics and pediatric cardiology. He's a fellow of the American Academy of Pediatrics, is a fellow of the American College of Cardiology, and is also a member of the American Heart Association. Dr. Alpert has a special interest in treating prolonged QT syndrome, acquired cardiac diagnoses, in addition to treating all forms of congenital heart disease. Next is Dr. Nicole Marcantuno. With a passion to help all children reach their fullest potential, Dr. Marcantuno specializes in and has been published on the topic of brain injury and concussion, treating a wide range of disabilities, conditions, and injuries to help patients achieve their maximum mobility. Dr. Marcantuno received her medical degree from Drexel University College of Medicine and completed her residency pediatrics physical medicine and rehabilitation at Thomas Jefferson University AI DuPont Hospital for Children. She provides many critical treatments, including but not limited to Botox injections, intrathecal baclofen management, pump management, electromyography, EMG, and dry needling. Dr. Marcantuno believes in a family centered approach to care and involves youth and their caregivers in decision making when developing their plan of care and work together as a team to obtain the best outcome. Dr. Ulrich View is a double board certified psychiatrist in child, adolescent, and adolescent psychiatry. He completed his undergraduate degree at Cornell University, his master's in human nutrition at Columbia University, and his medical degree from the Philadelphia College of Osteopathic Medicine. Dr. View is currently director of Child and Adolescent Psychiatry Education and Training at Hackensack University Medical Center and has a private practice in Rockland County. Dr. View has held academic appointments at Harvard, Columbia, Mount Sinai, Meharry, and Toro College of Osteopathic Medicine. So, with that, I'd like to welcome you all, doctors. I appreciate you joining us today. And I'm going to turn it over to Dr. Alpert.
Thank you, Gina. Um, you can go to the next slide. This is a question that comes up all the time when someone wants to participate in sports, pretty much any intramural, any team sports. Interestingly enough, not for sports you do in your neighborhood, although I don't know what the difference is sometimes, but any organized sport that you sign up for is going to set up a cascade of events. In order to get into these sports, you have to go see your pediatrician or your primary caregiver. They will ask a lot of questions, and then they have a form given to them by the state that will ask certain questions. And if it triggers anything, you could need further testing. Next slide. Believe it or not, they have a form which is a 14-point American Heart Association recommendation for pre-participation cardiovascular screening of competitive athletes. Now, this is only cardiovascular and there's 14 points. This is required by state law, and I'll talk about that. But just to run through, they're going to ask, is there any chest pain, discomfort, tightness, pressure-related exertion, unrelated syncope? Are you passing out or nearly passing out? Are you having trouble breathing, fatigue, rapid heart rate, anything associated with exercise? Any recognition of a prior heart murmur, were you ever told? Elevated blood pressure. Have you ever been restricted from sports before for any reason? Have you ever had prior testing for the heart by a physician, pediatric cardiologist, and what were those findings? That's the first 7. Next slide. Then you get into the family history. Premature death, sudden and unexpected or otherwise before age 50. That's a key number. If you have someone who's 45 years old and collapsed, pretty much that's going to trigger a further testing. Disability and heart disease, close relative less than 50. Certain cardiac findings, hypertrophic dilated cardiomyopathy, long QT. It's not important to know what these are exactly unless it applies to you. Channelopathies, Marfan's, arrhythmias, genetic problems, any of these things. If your family has it, you probably know which one it is, but you don't need to know all of these, but you're going to be asked. Next slide. Then you get to the physical exam. Is there a heart murmur? Do you have good pulses, upper and lower extremities? Do you have anything that looks like a genetic syndrome, like Marfan's tall, thin, hyperflexible joints? What's your blood pressure in the sitting position? Is it elevated? Those are the 14. You go to the next slide. If you fail any of these, most likely you're going to end up going to a pediatric cardiologist. And what are they going to do? They're going to repeat the history, but they're going to have to do more than repeat the history. They're going to do a physical exam, which presumably is normal because it always was normal unless they found something on the physical findings. They're going to do an electrocardiogram, which is the one with the leads and the electrical activity. It's not recommended as universal, but this is a pre-selected population. You have to keep in mind there's like a 20% false positive rate. In other words, 20 out of every 100 people who have an abnormal EKG are probably normal. So it's not the perfect test. Yeah, there's a lot of EKGs you got to go through to find something. We have volunteer groups doing ECG screenings to find things. We've been all over the place for them. If anyone has an abnormal ECG, you can trigger more testing. So you've started with the screening from the pediatrician. Now you've gotten to the pediatric cardiologist and they're working through, was the physical okay for them? Was the EKG okay, the electrocardiogram? Next slide. The next test, and everyone knows about this, the echocardiogram. If there's any question, the final test will be the final test to make sure there's nothing going on is the echocardiogram. It's an ultrasound. It's much more sensitive, much more specific. It's easy to perform, but it's the electrocardiogram is cheaper and easier to perform. These tests start to cost money, so you don't like to do them on everyone, but some people have it. Division I athletes in the NCAA all have electrocardiograms and echocardiograms because those are highly competitive, high-risk athletes. Next slide. I wanted to go back. If you get through all of that, and most people, it seems like who would ever get through any of this, right? 99% of people get through all of this and never see the cardiologist. They go through the screening with no problems. A few people make it to the pediatric cardiologist, and almost all of them are normal too. I don't want you to think we're actually finding a lot of things. We don't. But, I always tell people in the office, if I see 100 people and I'm right 99 and wrong one, it's a disaster. We're trying to be right every single time. No one's impressed when you're right in this business 99 times out of 100. You really have to shoot for all 100, which is why these testings are done. Now, the question comes up, what do? You're cleared for sports like most people are. What's the first thing you do? I can tell you, adolescents particularly don't seem to believe in hydration. You have to drink enough. I always teach this, and you can see it on the right, like number 1 through 8. Your urine really needs to look like number 1. For most people, that's 80 to 100 fluid ounces a day. I always say that's about 5 16-ounce bottles if you want to think like that. Gatorade works, has a lot of calories, so you better be doing a lot of. Gatorade's great if you're doing a lot of sports. If you're sitting at a computer drinking Gatorade all day, you're going to put on a lot of weight. Energy drinks, the Red Bull, the Monster, that's a diuretic. It speeds up your heart rate, makes you lose fluid. Stay away from them. I mean, it's amazing how many adolescent males, but to females too, but mostly the males, are taking all these energy drinks as if this helps. It makes it much worse. Obviously, no vaping or smoking. ADHD drugs, I bring them up because there's more people than you think are on these drugs. These are mostly stimulants. Some of them are amphetamines. Some of them are other forms of stimulants. This increases metabolism, and it causes a diuresis as well. So if you're going to be on an ADHD drug, you can do ADHD drugs with sports, but you really even need to be more careful about hydration. Hydration is really important, and it's amazing how many people don't hydrate. It's not like you ever see in sporting events, they come off the field, they take a couple squirts from a squirt bottle. That won't work. You can't hydrate orally on doing it that way. You have to come in hydrated. You should be looking like your urine is number 1 before you even start. If it's not, you're not going to hydrate on site, and it's dangerous. So I always laugh when I see people like squirt. I mean, you should always take a water bottle, but if you are not hydrated going in, you're not going to make it up that way. Water is absolutely the best. I mean, but if you're not going to take water, stay away from caffeine drug, anything with caffeine in it. That would be my recommendation. Somebody had asked a question I think that came up, and I'll mention it here. What about other types of food? Well, there's a reason why people, this isn't my field of expertise, but there is a reason why people carbohydrate load, because it does give more energy. So that's where the focus would be, on carbohydrates. Next slide. I always mention this because when you're out in the fields, you've gone through, because I think it's important, probably the last thing I'm going to talk about, but you go through the pediatrician, you get cleared. Even if you go to the pediatric cardiologist, you get cleared. Nothing is absolute. Again, we're shooting for 100% success. So you've got to have the back end. I always ask parents who do sports, when you're out there, does anybody know CPR? Does anybody have an AED? Is there an AED on site? It's actually the law. But it's amazing to me that all the people will go through all these steps. Then they get out on the sports field. Nobody, I'm sure people are trained, but if you ask the average parent who's watching their child play, whether it's practice or a game, is anyone trained in CPR? You always assume it, but you don't really know it. Does anyone have an AED out there in case something tragic happens? We assume it, we don't know it. I would tell every parent to make sure wherever you are, there's an AED, and people know CPR. Don't assume it, and I'll go from there. Next slide. This is an AED, and I'm telling you, the schools are required to have it, but it's the way the law is written. If you're playing basketball and they have one on the wall, that's fine. And if you're out playing an organized football game and the first responders are sitting in the end zone waiting for a problem, that's fine too. What about if you're out at soccer practice or football practice and there's no one out there but you guys? What would happen if there was an event at a practice session? Somebody going to run into the gym and get the AED? It'll be way too late. Does anyone really know CPR? I would just pay attention to every session that goes on. Do people know it CPR? Is there an AED on site? I'm just mentioning this as I finish up because you do everything to get ready, but are you really ready if something unprepared happens, which, rare, but it happens. Next slide. AEDs, just to put the two together quickly, CPR buys time, but AED saves lives. You've got to have both. If you're just doing CPR waiting for the first responders to show up, it's going to be a disaster. You got to have both. Next slide. And I mentioned this, like I said, there is a law in New Jersey. If anyone ever looks it up, it's called Janet's Law. They're required to have an AED on site. But I can tell you that can be inside the building while you're outside. You've got to be sure you know where these things are and somebody can get it within 30 seconds to a minute. It's actually the law, but I think the law's a lot looser than it should be. So, and the next slide, the final one, I think. Let me just summarize where I just said. You start with the pediatrician. When you're going to do organized sports, you start with the pediatrician or the primary care provider. In most cases, as I said, clearances are issued at that level. They answer that state-required 14-point pre-participation form with positive findings, and most people never make it to a specialist, but a few do. If you make it to the cardiologist, you'll probably get a history, you probably get an EKG, you may very well get an echocardiogram. If there's a rhythm issue, you may get a Holter to check rhythm, and if you're having symptoms with exercise, you may get a stress test. It rarely ever gets to that. There's a logical pathways you can see to get the sports clearance. And I will tell you, this is something, this next to the last one's a big deal. I get this all the time. If your child's going to need a sports clearance, your 14-year-old patient, your 14-year-old child, boy or girl, is going to need a sports clearance. Don't wait till the last minute because you might get into your pediatrician, but specialist waiting times are a lot longer than we'd like them to be. And calling up and saying my child has to be cleared for sports by tomorrow is not going to work. We get it all the time. You can't have 100 people calling up for 10 spots that were booked 3 months ago saying, I have to be seen tomorrow. Be aware that you want to get these clearances as early as possible, not as late as possible. And the final thing I'd say is, if I teach you nothing else about behavior and nutrition, stay hydrated as I described. Urine light colored, lots of fluid. And, I didn't mention it. You probably should be eating more salt also to retain the fluid. And that's all I have. Thanks for listening.
Hi, everyone. Thanks for being here. I'm Nicole Marcantuno. I'm a pediatric physiatrist or rehab doctor. Next slide. Today, we're going to be talking about concussions. It's something that I unfortunately see a lot of in my practice. So today, I just wanted to provide a basic overview for how to identify a concussion. How do you know if your child has a concussion or just got a bump to the head? I'll go over some basic concussion management, what you should do in the first couple of days. And then we'll go on just to talk about some prevention strategies for sports-related concussions, as well as do a brief talk about some of the baseline testing that is available in the Northeast for concussions. Next slide. So real quick, the most important thing to know now is that a concussion is a brain injury. It's more of a functional injury, so we don't really see any bleeding or bruising or swelling there. It most of the time is caused by a direct bump to the head, but it can also be caused by a blow to the body where there's some whiplash or the forces get transmitted up to the head. So that's important to know that if your child falls hard enough, even on their bottom, that can actually cause the brain to shake inside the skull and can give them a concussion. Many, many years ago, we thought that you needed to lose consciousness to have a concussion. That is not correct. A CAT scan would typically be normal. There are certain times where there are specific criteria called the PCARN criteria that emergency rooms will follow to determine whether your child actually needs a CAT scan or not. And the big important thing is if they have a CAT scan and it is negative, that does not mean that they do not have a concussion. Next slide. Concussions are very common. It's estimated that at least 20% of all adolescents will sustain a concussion. This includes even those that do not participate in sports activities. And so this amounts to at least 43 million adolescents in the United States as of 2021. So this is a very large number. I'm sure a lot of you either have had a child with a concussion or know someone who has had one. Next slide. There are many symptoms that we can see with concussion. A lot of people know to look out for headaches. This is, in fact, the most common symptom that we see, but really only about 85% of patients with concussion will actually experience headaches within the first day or two. Other things to look out for are confusion, dizziness, brief visual changes, trouble concentrating, difficulty sleeping, nausea. There are many things that we can look for. Next slide. Early on in concussion, the most common things we see in addition to these headaches are feeling lightheaded, trouble paying attention, concentrating, or feeling just overall foggy. Kids are tired more easily. They're sensitive to light and noise. Big thing parents complain of is they are very irritable or will cry or anger very easily. Next slide. Many concussions can be managed without a trip to the emergency room. However, there are certain times where we do want to bring them into the emergency room. So certainly if when you're feeling their head, it seems like there's a big step off, which could be a broken skull, we would want to bring them in. If they have an extremely severe headache, it's progressively getting worse over time. Certainly if they seem very very confused. You feel that their behavior is very unusual. They're lethargic, so not just tired, but more like listless. They can't really move their body, can't lift their head. You feel like their walking looks really unsteady, off balance. Certainly, if they're complaining of weakness or extreme numbness in an arm or a leg, if they have recurrent vomiting, we would define that as more than 3 episodes of vomiting. So not just necessarily vomiting like 4 times in a row back to back, but having at least 3 separate instances of episodes of vomiting there. The most important thing in concussion management is that for the first day or so, 24 to 48 hours, we want to scale back on activities like thinking and physical activity. Certainly, we do not want kids on extreme bed rest where they're just laying around all day, because that can actually make them feel worse. It's okay for them to lay in bed much of the day or for several hours, even during the daytime, the first day or two. But really, after that, we want to get them up. We want to make sure they're, having meals with the family and gradually reintroducing basic activities such as school attendance. Big thing you can do at home is to actually treat their symptoms. So if they're complaining of headaches, giving them some ibuprofen or Tylenol is okay to be doing, making sure that they're getting the right amount of sleep. When they see a physician, we're looking at their thinking and treating any of their cognitive disturbances. We're also looking at their eye movements and balance, and treating those activities. When they are returning to school, it's really important that if they're still having symptoms, that we don't just throw them back in to do everything except for gym class. We really want to introduce some accommodations like cutting down on screen times, allowing them to take scheduled rest breaks during the day or as needed breaks if their symptoms increase. We tend to ask for a reduced workload, letting them wear sunglasses and earplugs, or leaving a classroom if it's extremely loud. This helps them be able to continue to attend school, but still manage their symptoms. Big thing we say is absolutely no contact activities whatsoever. So returning back to like a full sports practice, or certainly gameplay, gym class, or full recess activity. We want to make sure that they are fully recovered before returning to these things, because while the brain is still healing, not only is it a lot easier to get another concussion, but also easier to get a more significant brain injury. Something that I see out there a lot of times is if a patient is seen by an emergency room or their pediatrician, sometimes they'll say no sports for 2 weeks or no sports for 4 weeks. They'll put kind of a timeline on it, and there is no specific timeline to follow. The big important thing is that the child is in fact fully recovered, which means they have no symptoms, their thinking is back to normal, at full school demands, that they're able to tolerate non-contact physical activity without symptoms, and that they have a normal exam, neurologic exam, including their eye movements and their balance. Next slide. Most concussions will heal relatively quickly, but I think not as quick as some parents may expect. So about 50% of kids are fully recovered within the first 2 to 3 weeks. We see that number jump up to about 80% at 4 to 6 weeks out from their injury. And then the majority, 90 to 95%, are fully recovered within 8 to 12 weeks. Next slide. There are some risk factors that are associated with prolonged healing. So if there is a history of prior concussion or some other prior brain injury, kids who have pre-existing headaches, especially migraine headaches, or deal with any sort of chronic pain or chronic medical condition may take a little longer to recover. If there are any pre-existing mood challenges or psychosocial stressors going on. And for some of those younger children, those school age child, we may see a little bit longer recovery as a group. Next slide. The big important thing here is that we allow for a return to learn before return to play. So this means that the child is back to full school demands, full home activities, including screen time, before we allow them to participate in contact activities. This is really important because sometimes what we see is if a child has a concussion over the summer when they're not really expected to do a ton of thinking, they're not doing, schoolwork, sometimes they'll be sent back to play too early before the brain has been given a chance to fully recover. So during the summertime, a lot of times we'll start to increase some of those cognitive challenges first with reading, with some neurocognitive testing that we can do in the office before we allow them to go back to contact over the summer. Big thing, don't allow them to return to play until they are entirely asymptomatic and that they are not taking any medications for headaches or other symptoms going on. When a child returns to play, there's a very specific stepwise progression that we want to follow to make sure that as we're increasing that intensity, we're not getting any symptoms along the way before they're released to contact sports. Next slide. Just as Dr. Alpert mentioned, there is also legislation in New Jersey that any student athlete who has a concussion or other type of head injury cannot return to competition or practice until he or she has returned to regular school activities and is no longer having any symptoms of injury. Next slide. Couple tips when it comes to preventing concussions. I think it's important to teach our athletes that it's really not smart to play with a concussion, that we can cause more severe and permanent long-lasting damage if we do continue to play and take another hit. There's a lot of state legislation and prevention programs are out there that are available for coaches and parents as well as the athletes. So making sure that they are being educated, especially with those coaches out there, because there's not always an athletic trainer on the field, depending on the age of the child. Next slide. Things you can do as a parent or the athlete can do is making sure that the proper protective equipment is worn for the sports activities and that it is fitting properly. So any helmets should be snug, not really moving around. You want to make sure that your coach has some concussion training and doesn't ask the child or teen, hey, do you feel okay? Do you want to go back in to play? Because inevitably the answer will be yes, most of the time. Some other prevention strategies include neck muscle strengthening program and neuromuscular education programs that can be done for particular sports, as well as limiting some of the contact practices, such as for tackle football. Next slide. Lastly, there is some baseline testing available. So this is testing that is done before the sports season is completed. And by having this testing done, it allows the clinician to compare the child after the concussion to what they were like before the concussion for a more accurate assessment of that recovery pattern. So a couple of things that are out there are some computerized neurocognitive evaluation. A lot of the high schools out there will actually offer this baseline testing before the sports season. It's typically good for 2 years. So it's usually done freshman and junior year for children that play throughout their high school career. Two of them out there are Impact and Sway. may include a baseline balance evaluation. So there's some testing that can be done in the office, as well as another computerized testing that is available in some places in the Northeast. And then there's also some visual evaluations we can do. One is assessing their visual tracking during head movements and eye movements, and another is called the King-Devick test, which can monitor their visual tracking and scanning as well. Next slide. Just to reiterate, the criteria for return to play, going back to contact activities, is having normal neurologic function and exam, that they are symptom free, and that they have returned fully to school without any academic limitations or accommodations. Next slide. The CDC website has a lot of good information out there. It's actually separated for parents and coaches and athletes, called Heads Up. So if you're interested in learning more, that is a good source for you. Next slide. Another good resource in New Jersey is the Brain Injury Alliance. They also have a lot of information on their website. They do workshops. They have like fact sheets and handouts for teachers, as well as for parents as well. So you can get more information there. Next slide.
Thank you, Dr. Marcantino, and also thank you, Dr. Alpert, for really solid presentations. My name is Dr. Oleg V. I'm a child and adolescent psychiatrist. Can you go to the next slide? One of the things that I do want to talk about, but I also want to talk about some of the negatives, also some of the positive aspects of sports and being involved in sports as a child and as an adolescent. Remember, a society is judged by how it treats its most vulnerable members. So I want to give a story, an example of a story. My son Andrew will never get married. He won't have children, won't drive a car, and won't experience many of the things we consider normal, even take for granted. But he is happy, and that to me is all that matters. When a stranger responds to him with a smile, my whole day lights up. When a girl gives him a kind look, joy bursts not only on his face, but throughout every movement of his body. It doesn't take much to make him happy. It doesn't take much to be deeply human. Here's the story. During a party held at a school for children with special needs, the father of one of the students gave a moving speech that stayed in the hearts of everyone present. After thanking the school and the staff who work with dedication and heart, he shared a reflection. Where nothing disturbs the balance of nature, the natural order of things will reveal itself in all its harmony. Then he added with a trembling voice, but my son Herbert isn't like the others. He doesn't learn like other kids. He doesn't understand the way other kids understand. So where's the natural order of things in his case? Silence fell over the room as the father continued. I believe that when a child like Herbert is born with a physical or mental disability, the world is given a rare opportunity, the chance to show the true essence of the human spirit. And that essence is revealed in how others receive and treat him. Did the father share a memory? One day he was walking with Herbert near a field where some boys were playing soccer. Herbert looked and asked, Dad, do you think they'll let me play with them? The father knew that in most cases the answer would be no. But he also knew that if they said yes, that simple gesture will give his son a priceless sense of belonging and dignity. So the dad timidly approached the boys and asked one of the boys, without expecting much, if Herbert could join the game. The boy looked at his friends and hesitated for a moment and then said, We're losing 3-0, but there are 10 minutes left. Sure, we'll let him come. We'll let him take a penalty kick. Herbert ran to the bench with a huge smile. He put on the team jersey while his father's eyes brimmed with tears and watched with a full heart. For the rest of the game, Herbert started on the sidelines, beaming, cheering for the other boys. The other boys slowly began to understand what the father saw. His son had been accepted. Then, in the final minute, Herbert's team earned a penalty kick. The boy who had first welcomed him turned to the father and nodded. It's his turn. Herbert approached the penalty spot with uncertain steps, ball in hand. The goalkeeper of the opposing team understood right away. He stood between the post and then slowly dove to one side, leaving the goal wide open. Herbert kicked softly, and the ball rolled slowly across the line. Goal! His teammates erupted in cheers. They lifted him in the air, hugged him, celebrated him as if he had just scored the winning goal in the World Cup finals. The father ended, his voice full of emotion. That day, a group of boys made a choice not to win a game, but to give the world a lesson in kindness, humanity, and love. Herbert did not see the next summer. He passed away that winter, but he never forgot that for that one day he was a hero. And his father never forgot coming home that night, watching Herbert's mother hold him in her arms, crying with joy as he told her about the most beautiful goal of his life. Next slide. Obviously, there are very, very positive lessons of sports. And I fully, as a child and adolescent psychiatrist, I often use sports as a modality for treatment for some of my kids that have ADHD, learning disorders, anxiety. The beauty of sports and research has showed that student athletes are more likely than their non-athlete peers to engage in health promoting behaviors, such as daily physical activity, sleeping at least 7 hours a night, eating fruits and vegetables, and drinking less soda. High school student athletes also appear to be more competent in school and have higher expectations to continue education beyond high school compared to non athletes. Student athletes report higher perceived self esteem and are more confident in their ability to achieve specific goals compared with the non athletes. So these are the positive things of sports. Next slide, please. But what are some of the challenges and some of the challenges that I face working with student athletes? One is burnout, anxiety, depression, and performance anxiety. And in many ways, right now, the concept of sports, it's a billion-dollar industry. And I'm fortunate from the perspective as a child and adolescent psychiatrist that has a subspecialty in sports psychiatry and high performance psychiatry. I've had the pleasure of working with many former athletes, and they've retired. And I remember this one conversation that I had with an athlete, a pretty prominent athlete within the New York metropolitan area. And this athlete had stated that he is so frustrated with youth sports because there really isn't that much fun. He feels that a lot of these kids are focused on sports at a very, very early age. They're looking at sports as a way to get scholarships. They still have this dream of making it to the professional leagues. And he stated that in his situation, he started to play his chosen sport when he was in high school. And he's stated that the fun in sports, from his perspective, is not the same. And that was a major, major critique that he had as a former athlete. And these are some of the things that I'm dealing with. Next slide. First example, I'm talking about burnout. So the first case will be Jennifer. Jennifer is a 16-year-old female, and again, these are not actual cases. I'm just kind of giving an example of some of the things that I deal with on a daily basis. But just to kind of give this example, Jennifer is a 16-year-old female. She's a junior in high school with a 4.0 GPA and has taken honors classes. She does have the diagnosis of ADHD combined type, and she's on Concerta. She's a very competitive tennis player with the goals of earning a scholarship at a Division One school, and the long-term goal is to become a lawyer. She's been playing tennis since the age of 5 when she was in kindergarten. She's a top player in her high school varsity team, but she's noticed that her performance has begun to suffer and for the first time in her career, she views tennis as a burden. Obviously, this is a sign of burnout. Next slide. Michael. Michael is a 9-year-old boy in the fourth grade. He's in the Gifted Talented program. He has been introduced to multiple sports, but for the fourth grade, he decided to focus solely on baseball, where he's on the town's traveling Little League team. Again, for the first time, he's experiencing anxiety when he plays to the point that he's becoming physically ill, i.e., he will state that before he plays, he will vomit. He will state that the night before the ball game, he's having difficulty sleeping. So it's basically bringing up the anxiety. Next stage. Next case. Jeff. Jeff is a 14-year-old boy in ninth grade on the JV football team. Jeff has an IEP for the diagnosis of a learning disorder and has been in special education. However, he is proud because for high school, even though he still has the IEP, he has been mainstreamed. He's taking regular classes. He's been playing football since the age of 6 and then has enjoyed the sport because it's the sport playing football. It's given him a level of confidence. He's been able to form a good peer group. But recently, within the past couple of months, he has been complaining of trouble sleeping. He has a lack of interest in playing, which is something that he used to love doing. He's feeling guilty. So if he plays poorly, he will take on all of the blame within himself. He's also been experiencing decreased concentration. Last case, Heather. So this is an example of performance anxiety. Heather is a 13-year-old female in the eighth grade. She has started ballet in the past 2 years and has adapted well to this activity. With the increased focus on this activity, she has noticed that she is not doing as well in performances, but yet continues to excel in practice. So these four events that I showed you that I've presented have basically been dealing with some of the onset, the adverse sequelae that we deal when we don't put sports in its proper context and how it can lead to issues. So, for example, Heather is suffering from what we would call choking. In students athletes, this is a common issue characterized by heightened stress and anxiety that negatively impacts athletic performance. This anxiety can manifest physically, i.e., rapid heart rate, sweating, and psychologically fear of failure, having these negative thoughts. It's a natural response, but can significantly hinder an athlete's ability to perform at their best. And one of the reasons why I'm mentioning these four common adverse events associated with sports is that it can lead to a lot of negative issues. So, for example, the case of burnout, which we also refer to as overtraining syndrome. This is a condition which the athlete experiences fatigue and declining performance in his or her sport despite continued or increased training. And because of this overtraining, that can actually lead to other problems and make that person a little bit more vulnerable to mood changes, decreased motivation, frequent injuries, and infections. The anxiety that I spoke of the second the kid that was playing the baseball, is that anxiety in general is the most common mental health concern for all student athletes. And it's basically this feeling of feeling overwhelmed and anxious. The key things that we need to do when we're dealing with anxiety is to try to recognize these symptoms early so that we can actually have an early intervention. And depression. Depression is a major issue. And also, One of the concerns that we have with depression is that it's something that's often underdiagnosed. Research indicates that their kids are at a higher risk of developing mental health problems like depression and anxiety. And these factors that can lead to depression can be intense training, high academic standards, and social pressures. These are all things that can contribute to these issues. So the next slide, how do we cope with these problems? First and foremost, it's really important that as parents, as guardians, as coaches, we have an open and key thing non-judgmental communication. Communication is really, really important. And there are stories of athletes, Division One athletes, professional athletes who have said that even though they may not have been close, or maybe their parents may not have given them the support that they needed, but their coach, that person, played a phenomenal role in their lives. So again, that's really based on the issue, the aspect of communication. One of the things that we really, really, really have to focus is on promoting mental resilience. And that's one of the beauties of sports. In sports, there are key life lessons that are that are being taught. The lessons of understanding delayed gratification, the lesson of commitment, the lesson of empathy. These are really, really important lessons that sports offer the athlete. You also want to encourage hobbies and activities outside of sports because one of the things, if you have a really talented athlete and everything is all about sports, everything's all about sports, then that leads to a lot of anxiety, and there's almost a thought process that they really can't do anything else. So you want to make sure that there's a proper balance. Now, with some of these issues, i.e., the depression, i.e., the anxiety, another thing that I also want to mention that's very, I also feel that's often underdiagnosed is eating disorders. Both females and males can also have eating disorders as well. And when these things are happening, where there's extreme anxiety, extreme depression, possible eating disorder, you do need to seek professional help. Key things to keep sports fun, because the reality of the matter is that less than 1% of high school football players will make it to the NFL. Same thing for basketball players, same thing for hockey players, same thing for soccer players, etc., etc. So keep sports fun for these kids. Also, you want to focus on life's lessons. And another thing that you really want to focus on is educating the coaches and parents on how to form a solid, nurturing environment so in which these kids can excel. Next slide. I'd like to share of an interview that I was a part of. This was a part of an event in which this Gary Payton, he actually happens to be NBA player for the Golden State Warriors. Gary Payton second. He's the son of the famous basketball player Gary Payton Sr. And Gary Payton second is an example of a person that had a learning disorder, but used sports to help him, deal with his illness. And obviously, he's been very, very successful. Next slide. Of course, when it comes to looking for help, we do have a sports and performance psychiatry at Hackensack University Medical Center, and this is a picture of myself and my staff, and we've also included the contact information as well. Thank you.
Thank you, doctors, for all this valuable information you shared. We really appreciate it. At this time, we're going to answer a few questions that have been submitted. I believe the first question is for Dr. Marcantuno. You mentioned proper sports equipment. This question is, do you have any insight or thoughts on Guardian caps and or Q collars?
Yeah, so some of the unfortunate things about those newer protective equipment is we don't really have any, double-blinded randomized control trials, which is really the gold standard of trials to actually say whether they provide a significant difference or not. Certainly, the pretense behind the Q collar is that we know that a lot of the forces that the body and head take can get transmitted through the neck, causing a lot of that whiplash that I talked about, where the head can kind of bang on the inside of the skull there. So, with the Q collar, the idea behind it is that it is absorbing some of that impact. It's kind of similar to some of that neck muscle strengthening that we had talked about before, that can be really helpful in prevention of concussion. I think with any of those special equipments, the Q collar, the Guardian cap, some of those headbands that we see for soccer and lacrosse activities, is as long as your child is playing the same way, meaning they're not playing more aggressively or taking more risks, if they have that equipment on, then it's probably a good idea, meaning it may help prevent concussions. But again, we don't know with absolute certainty. If you feel your child is going to be more risk taking, kind of throwing their body into people more, or dropping their head down and trying to like spear with the head in football, which is illegal, but we still see happen, then I would say that the risk of them doing that probably outweighs any benefit of that protective gear.
Thank you so much. The next question, Dr. Alpert, you mentioned nutrition and hydration in your presentation. This question is, my son is a first-time track athlete. What should he eat before and after practice? Any tips?
Yeah, yeah. Sorry, I touched on this a bit during the talk. The most important thing you can do, just from a cardiac point of view, is hydration. And I went over that you really have to be well hydrated, mostly with water, and you need to be hydrated before you start. That I went over. I'll also add in here, that, if you athletes are known to, this isn't cardiology, but athletes carbohydrate load all the time. So I would tell you that's where the instant energy comes from, is from carbohydrates. Now that was something that could be done, but again, I would emphasize the hydration over the carbohydrates. But if you're looking for where the energy comes from, it comes from carbohydrates. But you really have to make sure you're properly hydrated before you begin any sport. Otherwise you could have really collapsing on the field.
Thank you so much. This question for Dr. View. There is so much pressure on young athletes in this travel sports world to specialize in that sport and train year round. Is there any guidance on any physical and or mental health effects of the year round expectation and specialization?
Yeah. It's kind of like I gave the example in my talk where that former athlete I mentioned, that's one of his concerns. And I would say that the most important thing is that you need to make sure that the student is taking this is really their choice, i.e., sometimes the pressure can come from parents, it can even come from coaches. So you want to make sure that the student is actually taking ownership. So once they take ownership in their sport, they're more likely to view this as a form of mental health. So I think that would be the way that I would address that aspect.
Thank you so much. Dr. Marcantuno, this is for you. I have a 13-year-old baseball player who is already complaining about chronic knee pain. How can you tell the difference between growing pains as he's growing through puberty and like a weed, and a bigger issue we should take him to the doctor for?
So, growing pains tend to be located more in the shin area. That's what we expect to see with the growing. If he's complaining of a specific joint pain, I probably would have that evaluated. There are certain things at that age that are very minor, patellofemoral tracking dysfunction where the kneecap isn't sliding properly. But there can be other conditions that are associated with knee pain in that age group as well. So it never hurts to just start with an evaluation with his pediatrician or family doctor.
Great, thank you. And the last question is for Dr. View. I've heard recently of parents reclassing their athletes Example, retaking a certain grade level to be placed in a different graduating class, to put them in a more desirable position, to gain attention, and ultimately a scholarship offer. What is the guidance on this? Are there any detrimental effects on a child's mental health, or is this a viable option to allow a child to pursue their dream?
Yeah. See, this actual concept called relative age effect was first brought by the author Malcolm Gladwell in his book Outliers. And he kind of gave an example of some NHL players that it has been seen that a lot of NHL players tend to be born in January to March. Um, Again, the issue with that is maybe there can be an advantage early, between like maybe second to sixth, seventh, eighth grade. But the reality of the matter is, by the time these kids get to high school, everything really balances out. And one of the concerns that I do have with this is that, again, it goes back to what is the priority. I mean, who's really motivating the child? So if this is something where a parent is telling a 9-year-old hockey player that, if you do really well, you may get a scholarship, or you may be able to play in the NHL, et cetera, et cetera, you're adding more anxiety. So I think it's one of those type of situations where you have to kind of look at it from a case by case basis and truly look for what is in the best interests of the child.
Again, thank you, Dr. Albert, Dr. Marcantuno, and Dr. View. These were such informative and important topics. We appreciate you taking time out of your day to spend with us and talk about these. And thank you to all of you again for taking the time to join us today. Please watch your email for an evaluation of the program and take time to fill it out. We want to hear from you, and also let us know if there are any other topics of interest you may be interested in. You'll also receive the link to the recording of the webinar, as well as a copy of the PowerPoint, as you may want to listen again or share it with others. It will also be posted on our website on hackensackmeridianhealth.org/kids. We will have several other parent forum webinars coming up in the fall that we hope you'll join us for. Please visit our website or call 1-800-560-9990 to register for those and find out more information about these upcoming programs and others. Thank you again, everyone, and enjoy your day. Thank you, doctors.